Hello.
Hi.
I'm here with Roman.
It's
Roman, a good name.
yeah.
Yeah. Okay. So, Roman, you are a physio.
Yeah.
And you choose a slightly peculiar specialization. You choose to treat patients with headaches.
Exactly.
So can you tell us a few or more words about why did you make this choice, and can we actually treat patients
Yeah.
with headaches?
Yeah. So my day started that in my journey about headache field started with TMG treatment because there is not a lot of physio in my country, in my city, that we are which treating TMG stuff. And then when you go in that kind of field, you met really early all the headache stuff and touch and type headache and blah blah blah. So I decided to start following courses for TMG stuff and then slowly move to cervical spine, slowly move to headache treatment. So now I'm providing courses about headache treatments and summarize all the point of view that we can find in the literature and in the courses for treating headache. And yes, physios could help with a lot of type of headache. Not all headache, of course, but a lot of type of headache and all the underlying approach with the cervical spine and the TMG stuff.
So with our techniques, with good choice of words and exercises, I know that you have this nice triad happening, and you promote this all these three things that should happen to actually help the patient. Can you tell us a little bit why we need all three and not only our hands and our techniques or only our exercises?
Because we know from the literature now, from many disease and many pain pathology, which is really, in the case of chronicity, we need to have a long-lasting effect with the patient, and to have that lasting effect, as we got in the biopsychosocial approach, we need to provide them some advice, we need to give them some exercise, we help them with manual therapy. This is our first line treatment most of the case, but we never have to forget that kind of dialogue, that kind of advice prescription and exercise prescription to have a long-lasting effect.
Okay, so the treatment will actually have a long-lasting effect, or it will be just temporary?
No, it could have a long-lasting effect in many cases of headache, but again, it's dealing with the patient and create a therapeutic alliances, as you mentioned previous in our discussion. It's just trying to change the process for the patient, and of course, to change this process, we need to talk with him. We need to provide him exercise that he have to do every day for a certain period. And then the manual therapy would be helpful for analgesic point of view. So it would be the same. And the other is really helping the patient with dealing with the headache, with dealing with the pain, chronic pain, again, because that's remain as a chronic pain.
Chronic pain can only happen in one type of headache, or chronic pain can happen in all type of headaches?
We're facing, in the most of the time, to an overlapping type of headache, and which is really chronic. So this is the point when you have headache patient. It would be identify all the components that we have. It will be making an assessment and an evaluation, which will help you to have more component in the musculoskeletal way and the articular way, and this is the point. And then providing him like good advice depending on the type of headache he got or not. This is the point. And to manage the life and the incapacity they have with their own pain.
What type of headaches can we have?
You can meet three big famous headache. It would be the tension type headache, it would be the cervicogenic headache, and the migraine. This is the most of the time the most biggest headache area that we can find, and we know that we got really good results by treating tension type headache and cervicogenic headache. The goal of it would be manage it the best way we can. And some literature are changing from 2-3 years now about migraine and the effect possible of treating migraine, more of a chronic migraine, which is remaining. Again, we find that concept of chronic pain.
Okay, but you choose, knowing all this, to write your PhD thesis about migraines.
Exactly.
So you choose the one that we can help the least.
Yeah, well, I'm not sure that we can help the least. I'm quite sure that we don't know how much we can be powerful or not by providing pain education or not, by providing manual therapy or not, and what's the real effect. We find really few universities about that, but some of them, even few, shows good results, like promising results. So would be the case.
Okay, so it's more an uncharted territory than actually an area that we really don't know if we can help or not.
Yeah, we got some feelings, but probably we can. And the goal of it would be, it doesn't matter the type of headache would come in your clinic. The goal of it is remember your work as physios and applying to that patient with headache some testing, some constraints, some palpation, some good looking for the range of motion or something like that, and then see if it's fitting or not with you. And this is really the core of the courses I provide. It's just giving to the physios good testing battery, good treatment, to see if the orofacial pain or the headache could be fit with us.
I think that you do a very good job in transmitting clear information and very easy to follow, both techniques and solutions for
Thank you.
for the headache. Why did you choose to be this efficient? Because you actually are quite efficient during your courses. It's not something that's too hard to follow, too scientific, so you choose to be more inclined in offering solutions.
Yeah, I think that comes from my journey again, because I am in a private clinic and I followed a lot of courses as a student. And the thing which changed a lot of things in my way of teaching was following the pain education courses, because I really felt that we have to give a good information to people, which is a way scientific and a way really simple in a way like undramatizing the situation. And this is the fact with headache. A lot of physio are afraid of headache because they don't know anything about that. They're a bit afraid of that. They're afraid of the trauma possible that the patient had. And so they're, getting back and back, and we can feel that there is a gap between the headache patient, the headache doctors, and the physios, because there is a no area. And that's the point. It's just put a light on this unknown area. And if you want to put a light, you have to simplify the things. That's the point I'm trying. And as I have 8 years of practicing headache treatment, I did a lot of testing in my clinic, testing that technique, that technique, that technique. And the more you go through that essential treatment, the more you can drop the thing which is not useful to go to a pure or a simplified method.
You you do it quite good. So
Thank you. I'm trying.
how do you like the evolution of pain education in the last years?
A lot of things are changing in the good way, I think, because we're making the patient more active. We're giving him more advertise, and this is a good point. I think the weakness of this system is sometimes it's misunderstood by physios, and sometimes it's a less sexy treatment that we can find with manipulative treatment, really fast, really sometimes mystic with the patient, and creating something like you put yourself in a bigger ranking than the patient. And this is more sexy, I think, to create something secret or something strong than simplifying the thing and explaining really simple things to the patient. So that's maybe the weakness, but a lot of things are changing, and I think it's a better thing to apply all this change about low back pain, of course, because I do love the low back pain. But I think neck pain and headache and even all chronic pain have to be really managed and put a light on it.
I totally agree that during the last years, the fact that the whole mentality goes more and more for empowering the patient, giving the patient more education, more good information, quality information about the problem that he or she is facing. I think at the end of the day, it will help them understand better themselves and the problem. But with the headaches, a lot of time they don't think that physiotherapy may help a headache, because there is a big marketing and commercials about the drugs and can help with headaches. And I think most of the time they only think about medicine, and pills that they can take, and okay, the pain should go away. So why or how can we make them understand that they can also come for physiotherapy to treat headaches?
I think the cycle would start with putting good knowledge to the physio first. Because even if we put the patient to the physio clinic, with a physio we don't know how to treat the patient, it would be the wrong way to make it. So that's how I see, really personally, my point of view is like providing courses again and again about understanding the headache, providing good evaluation, providing good treatment, or the best we can, by the way, for now. And it would be, I hope, different in 5 years and 10 years and blah, blah, blah. So that would be probably the first good step that we are leading for now. Then including all the headache research in the pain education, because this is another thing that we found and we didn't found, is the research and the SCTs applied with pain education and headache. It doesn't exist, or really rare. It's really few papers. But that's remain as a chronic. So we have to make it more popular in our profession to provide more scientific articles, and that would be a good cycle, because after a good publication or some good publications, doctors and would be know that. they would better understand what we do and why we do that. And this is, I think, one of the steps. The other thing is giving courses again to the doctors to have, our same conversation with the doctors, with the physios, with the patient at the end of it. So that could change the process of all that situation. And we know from a scientific point of view, some chronic headache are really resisting to the medication. So the medication is not working well on some chronic headache. So that reinforces all that system.
I know that you already finished some research on headaches, no, and chronic pain.
Yeah.
Can you tell us a little bit about your work in the last 2 years?
Yeah, we did. So I did a lot of research of what's the missing piece, and then we started by making systematic review, which is really common case when you start a PhD. So we did a lot of we did systematic review about pain education and migraine. We did systematic review about migraine and physiotherapy. And we did another, because this is touching me, because I see a lot of patients like that, about post-traumatic headache and physiotherapy. And was all the same process, because it's you get some LCTs, but not that much, less than 10 for every part. So it's really few.
Mm-hmm.
Some are good. There is not that much bad LCTs, but really few patients in the LCTs.
From 10, you cannot have too many bad.
Yeah,
at maximum of 10.
But they are quite good. But this is the point that usually when you get a good LCTs or something, after your colleagues retake it and redo it again and again and again until having a lot of LCTs to show that it's working. And a lot of the time, you took LCTs which work to confirm the good working. And this is not the case in migraine. And I think, again, it's because physio doesn't interested and they don't know it. And they don't imagine that we can help to unsensitize the patient, help to decrease the frequency, the intensity of the migraine, or making better lifestyle for the patient. So it's really the point. And that's what we found. We found good recommendation, but again, you can find like really soft treatment. Like one of the physiotherapy applying to migraine was just they talk about stretching, but that's it. So we don't know what they do.
What type of stretching?
Yeah, or neck stretching, or sometimes you can find paper like we did the neck mobilization. That's it. So I don't know which one or what type of. So that's really what I'm trying to do in my courses, and what I hope that will happen in the scientific literature is being really describing
and more specific.
And describing everything. And what I'm doing is pick up good treatment, which is really effective and with a strong evidence for some piece of the puzzle. For example, good techniques applied on the upper cervical spine that we know that could help the upper cervical spine, and then applying that to that model of the overlapping system of headache.
Okay, I think it's one of the reasons why physios don't approach too much and we don't have too much research on this is the fear of the unknown, because it's a big mystery, the migraine. It's with the history of the humans since the beginning. We have very big personalities that were declared by and also defined by migraines. Their life was always touched by migraines and headaches, and so in a certain way, due to the fact that nobody found a real cure or treatment for this long, we think that okay, it's something that we cannot touch. It's something that we cannot influence too much because it's chronicle. Once you have it, you have it, and that's it. So, thank you very much for doing this because you share some light on the subject, and you doing things in the easy way and not creating some abstract mysticism behind it. It really helps because it feels real. It feels that okay, we can have this type of
Headache,
manifestation, this type of headache. We can have overlapping between the three options that we have, and we can help at least for our part. We can do our part. The musculoskeletal issues. The chemical we don't know yet.
Yeah.
Okay, so
that's the point. And that's another thing about migraine, and a thing which driving me to that area. It's when you started to read about what treatment we provide as medication for migraine. It's a lot of time the prophylactic one.
Mm-hmm.
The goal of the prophylactic treatment of migraine is unsensitize. For instance, and sensitize the vascular system. So they're trying to put and to play with the threshold of the patient with medication, but it's exactly what we do with our hands, our dialogue, our exercise. So the way is quite the same. They are not treating chronic migraine in the same way that you can treat or avoid a systematic chemical system,
Mm-hmm.
It's more about the goal of unsensitize the process. This is really the case. And when you get chronic pain, the features of the patient and the look for the patient, it's really the same time, the same things for all chronic pain. And this is really my belief of that.
As I saw so far in my practice, the chronic patients, I didn't see so far too many headache patients.
But chronic patients.
Chronic patients, yes, but headache patients, I have headache patients, but to be honest, as you said, it was always like a guessing. Let's try to see if it works. Let's try to see if it's not working, but it was not something that I had like a systematic treatment. Okay, we tried, we had errors, we a few of the patients got better, but now that I followed your course and I understood a lot better the differences between the pain, the differences between the characteristic of the headaches. I think it will be a lot more real, the treatment that I can offer to the patients. So thank you for this.
You're welcome. Thank you to invite me.
So how do you feel in Romania?
Yeah, really good. Really good. Yeah, good beer, good restaurant, and people are really good. Moreover, in the Omtro session, they are really have good skills. So it helps me more as teacher because I can feel that they have already the same information that I'm providing. So I didn't waste my time with little showing and explaining some little testing or something like that because I already did it. So we just reinforced it, that process. So that was a really good thing. And the other point is that I can spend a lot of energy to explain them exactly what's my treatment plan, how I do really it, and for which session I do what and why I do that. And so this is better because at the end of it, and we have to simplify our treatment, our techniques to make it better and have more time to explain and make all that dialogue stuff in the chronic disease. So that was really a good point, and that was really good to be in Romania.
It's nice having you here. So you do you have the same impression as me that if we talk the same language, things are a lot easier, and we can share information a lot.
Yeah, of course, and everyone's win times because the information that I give is really scientific, and as they have already a scientific approach in their brain, I'm just putting other bricks which are really the same. So you go faster, and this is better. And the more you put the same brick on the same wall, the more the wall is strong. So this is the point, I think.
Yeah, I totally agree, and you use very good metaphors.
Yeah, I'm trying.
Give us a message for the Romanian physios, or for the not only Romanian, also for international physios, for physios in general. About
I would say a thing that we can find really easily about headache or migraine, or it doesn't matter, just headache, is one of the most biggest undiagnosed and misdiagnosed pathology that you can find. So this is one of the big points and the take-home message. Of course, you will be afraid of it because it's misdiagnosed, undiagnosed, or a lot of patients that I see have headache but don't tell it to anyone because they think that there is no issue. So that's the point. We have to really to put a light on it.
okay, so thank you very much for being here.
Thank you.
Thank you for this conversation.
It was my pleasure.
See you soon.
See you soon.
Bye.